Well, you heard me say coming up at the top of the show that we're going to be talking with Dr. Sam Shatkin from the Aesthetic Associates this morning on facial rejuvenation. So we've got the good doctor here with a willing patient, Kimberly Zach, who's a friend of mine, a lovely young lady. Kimberly, you, who I would say look perfect, but what are you looking to do today, right here on the air?
Trying to stay one step ahead of the aging process.
Aren't we all?
Right?
Okay.
Who doesn't want to look younger?
Yeah. All right. Well, Doc, then what are we going to do with Kimberly?
Well, first I want to start out by saying she's beautiful.
She is beautiful. Yes. Absolutely gorgeous. Yes.
You know, we had a conversation last week, and sometimes, you know, there's little things that need to be tweaked. There's not a lot that she has to change, and some people would say, well, I don't see anything that you like. But when we talked a little bit about maybe enhancing her cheeks, building up a little volume, you know, making it a little more prominent. You know, helping that, and she thought that was a good idea, and she agreed to do that.
That's the beauty of these fillers, is that if you liked your face 10 years ago, and gravity is starting to work on you, I'm not going to use my own hands on my own face, but why not? I mean, why not say, you know what, I really like this look. This, to me, I see it in the mirror. It appears I'm aging. I can actually stop that process.
Yeah, well, 10 years ago she was in middle school. So,
I know.
but no, but seriously, I think you're right, Linda. Sometimes little baby steps is all you need to stay one step ahead of things, and if you can do that easily, which we're going to demonstrate a little later today, you know, it's a win-win. Right. Patients love it. It's easy. The costs are very reasonable.
Reasonable now, yeah.
Now, and it's a simple process and with very little risk.
Taking care of little things today, you might be putting off the bigger procedures indefinitely, or at least maybe 10 years down the road.
Well, you know, if you do some maintenance on a daily basis. You know, like my brother's been on the show, and he's talked about dental care, and you know, our parents always taught us brush your teeth twice a day. If we took care of our skin twice a day when we were little, our skin would look better when we get to be our age. But we didn't do that, so now we got to sort of catch up a little bit, and that's some of the things that we can offer. And you know, Kim's had some other treatments at our office, of course, and today we're going to do something to fill up a little volume in her cheeks. All
right, well, we're going to get to that in a few minutes, but as you say, we're talking about maintenance, and you brought some products here that are available solely through your office. And you're right, if we start using better products on our skin, you might find that cumulatively, you're really going to have a lot less issues with your skin, and people will always say that you look youthful.
Right.
You have the ultimate cleanser here and a clarifying foaming cleanser. I know it's just part of the
you know,
line
I just want to, we have no less than 5 different cleansers in our office for all different types of skin, and people don't realize it. You know, they go to the pharmacy and the supermarket and buy their soap. You know, and they think it's one size fits all, and it's really not the case. Some people have dry skin, some people have oily skin, some people have acne-prone skin, some people have aging skin, some people have reddish type of complexion. Especially in the wintertime, we get a lot of people with irritated, red skin. So these are the things that we can adjust with them, with all the different products that we have, and I think that really makes for a difference in the end result, and that's what we're trying to accomplish.
I think there's an awful lot of people who have issues with their skin, and you don't realize it's because of the product that you're using, because you've been using that product for years. But you know what? You've changed. Maybe you're going through menopause now, maybe you've had a child. Things start, the chemicals in those products work differently when your body chemistry changes, and it may not be the right product for you. It's like using the same makeup after 20 years. It's not good. Well, you got to pay attention to that.
Well, you know what? It's interesting because I've talked to patients and they say, you know, I've been using oil of Olay since I was 20 years old, and now they're 45 years old. Maybe it was great back then, but now you need to do more, and there's different things that we can offer, and things are much better now than they were 25 years ago. So you should definitely consult your plastic surgeon and their staff. You know, we've got a tremendous staff at my office. Some of them have been on the air with us here today on the show with AM Buffalo, and you know some of the staff we have. Kim knows the staff. I mean, they're just tremendous and they're very knowledgeable. So together we can really help people get to what they want to do.
And you know, even now, as we're looking at the snow outside, it's so important if you're going to get anything with an SVF in it. Did I say that right? SPF. I was going to say, I think I'm driving a vehicle here. Wait a minute. But if you're going to have anything with sun protection, it's so much better to get it through your office, because the product itself is medical grade.
Well, that's definitely true. SPF is SPF, so you can know you're going to get a good quality protection. But the advantage of some of the products that we have or in the doctor's office are that not only do they protect you from the sun, but they also reverse some of the aging process. So why not do it all together? You need the right moisturizer, you need the right antioxidants, and these are things that we have in our own private label products, and I think they can make a difference.
Right, and you know, a lot of times we're swayed by the big perfume products their stuff is very, very pricey. And again, you could be buying more the label. You really are better off putting that money towards a better product and what's in the jar,
well,
rather than the pretty jar.
At least you know you get the product that's appropriate for your skin,
Exactly.
and that's important at a medical office.
Exactly, and especially if you're going to the Aesthetic Associates, you have something that would be perfect for your skin at your age. But like you say, if you've got kids and they've got acne, you can get them a product too that's going to be beneficial for their skin and not give them any kind of problems.
We treat all age groups.
You do, and that's important for people to understand. All right. What are we going to do with Kim in the next segment?
Well, you know, first of all, as I mentioned before, she's beautiful, but she's got some things that sort of bother her. And if you can just, I'm going to try to turn your head just a touch here, Kim. You can see she's got a little bit of a hollowness in here. It's not terrible, but we want to try to build this up a little bit and add her some volume to give her a little roundness to her cheek again.
Okay.
And she may have had it 10, 15 years ago, but either way, that's something that's bothering her, and that's what we're going to do today. And we could do that with a number of different fillers that we offer. The one that we're going to use today is Radiesse, great product, but we also have 2 other fillers that we use regularly at our office.
Now, what is the benefit of Radiesse compared to Juvederm? Like, why would you use different
They're
products
both
for different
excellent, and they're
things?
both interchangeable. We just happen to select Radiesse for today. I like the product. It's calcium hydroxyapatite. It's a product that's been well used worldwide, and certainly in the U.S. it's FDA approved for volume in the face, and that's what we're going to choose today.
And that, for people who are new to all this, that's different from Botox. That does something else.
Well, you know, that's a really good comment, because you know, so many patients come in and say, I want Botox around my mouth. I want to have fuller lips. I want Botox. Well, that's not really the case. Botox is really good for dynamic lines that you see in animation, the frown lines, for example. I can't show you because I had Botox here. But lines that you don't like when you're moving those muscles.
Right.
All right, and we want to limit those or reduce that. Lines that we want to fill, like the valleys around the mouth, putting some volume in the cheeks, corners of the mouth, those are done with a filler. So Botox paralyzes muscles. We use that for dynamic lines. Fillers we use for static lines that are there even when we're sitting and relaxed in a reposed position. So that's the difference between the two.
Now, just a few years ago, people would go in and get collagen, but this is kind of like the upgrade from there,
well,
right?
Collagen injections did the same thing we're doing now, but the big advantage now is these products last up to or more than a year. And that's nice, because the collagen was 3 or 4 months.
Right.
And at the time, and you may remember, we used to do a lot of fat injections 15 years ago. Now we're doing less fat injection because the products are much better and they last longer, and it's certainly a lot easier to open up a box, which we're going to demonstrate in a little while, and do the injections. It's much simpler.
Are many people allergic to the substance?
None of the newer products that are available need to have pre-testing for allergy.
Oh, that's great.
Which is great.
So the day that you go in and decide you'd like this, you can have it that day.
Yep.
You don't have to
Same
come
day.
back another time just to be tested.
Right.
All right. Kim is going to be sitting in the doctor's chair when we come back, and we're going to open the phone. So if you have questions about what Dr. Shatkin is doing, by all means give us a buzz at 644-9840. So don't you go away. And once again, the Aesthetic Associates Center always entertains free consultations. So if you'd like to go, give them a call, make an appointment. I almost said a reservation. Make a reservation. 839-1700. And don't forget, they do have now a secondary office on Kensington Avenue. Of course, that's the original in Amherst. The second one is now on Main Street in East Aurora. And you can always go to their website through greatlook.com. But we're going to be back, so stay with us. All right, everybody, there's nothing like seeing the proof of the pudding. And when we talk about facial rejuvenation and the non-surgical methods, certainly the injectables are high on everybody's list. We're talking with Dr. Sam Shatkin this morning, a cosmetic plastic surgeon, of course, from the Aesthetic Associates. He has brought along Kimberly Zach, who I've known for a long time. I think she's absolutely gorgeous. But we are all interested in kind of, rolling back the hands of time, Doc, and this is an easy way to do it.
Very, very simple way, and I'm going to demonstrate exactly how we go through the process. It doesn't take any longer than this in the office setting.
Okay.
Except I don't explain it all to them. But basically, we've got, this is our product that we're going to use today. It's called Radiesse, and I've pre-drawn up some lidocaine so I can mix it into the syringe. And I'm actually going to show it, so if you can take a look. It's sort of a neat process.
The lidocaine will help numb the area.
See, it's mixing right in there.
While she's getting the injection, so it doesn't hurt as much as you would think.
Right, exactly. So it doesn't hurt as much.
And it instantaneously numbs the area.
I'm just mixing it up for us.
I know people are saying, Linda, how do you know so much about this? Well, I guess that will just remain a mystery on our show. But I do a lot of homework for these segments. So just say, we'll stop there, okay?
We will, okay.
All right, I'm going to hold Kim's hand just because I love her, all right?
Okay,
and
so
she's a brave
here's the
girl.
syringe. So it's as simple as, once I mix the syringe, I select the areas I'm going to do, and Kim and I had talked about this ahead of time.
And again, from the first segment you talked about that as we age, the apple of the cheek is usually a little fuller.
Right.
So Kim would like that to be like that when she smiles again, okay?
Right. Well, I've selected, with my experience, I've selected 2 spots that I want to do for Kim.
Okay.
So she feels she wants to close her eyes, so that's okay.
Oh,
The rest of us will keep our eyes open, so I certainly will. Okay, so I'm just going to put it right in the spot. She'll feel, all she feels is a little pinch.
Just a little pinch.
And then I'm going to
is such a good sport here.
And then we'll get to look at the difference between the left and the right side.
Okay.
As we finish.
And that's the nice thing about this, it's instant.
And one more spot here.
Yeah, you see it instantly.
Oh yeah, you're going to see it right away.
And this is now going to last for months.
Okay, so now what I'd like everybody to look at, and all I do at this point is a little bit of just a gentle massage in there.
She's such a beautiful girl.
Now that was simple enough, right, Kim?
I felt nothing.
She felt nothing. Okay, now if you can zoom in a little bit.
I do see the difference.
Look at the nice volume and fullness she has there.
I do see the difference.
I messed up her makeup a little bit, but she's got that hollowness here.
Right.
So obviously we're going to do the other side to balance that, but can you see the difference?
Yeah, I
And that just took a couple minutes. And most people wouldn't know.
Thing. Right.
It's very subtle.
And that's why you start a little.
But we know,
and you barely feel anything.
You really are good.
Really,
you didn't even tear up.
Really.
Good, I did it.
I was nervous for nothing.
Yeah, well.
Because, you know, you're going to say, oh my goodness, a shot to the face. But remember, it's the lidocaine
That's good.
that makes that, you know, very
lidocaine numbs it up, but they do feel where the needle goes
in. And men
in.
have this too.
Oh, yeah,
it's not just for women. There's a lot of men who understand that looking a little younger, going back into the workforce, you know, it's just a matter of how do you feel about yourself. If you feel that you can look better, you're going to feel better if you look better, then this is for you. And that's really all there is to it. If not, it's not.
That is all there is to it, essentially.
Wow.
And, you know,
is she done?
We're done.
Wow.
I did it while you were looking at
Really?
it.
Oh my gosh.
She kept her eyes open this time, though.
I will come in and hold hands with anybody that, you know, needs it.
No, but see what we've done with very simply, we've injected some volume in her cheeks. We've given her a little bit more fullness, a little bit more to smile about, perhaps, although she's got a beautiful smile as it is. And I think we've accomplished something with a very simple approach. And except for a couple little dots she has, you can see.
Yeah, she could go right back to work.
Look at the new volume she has in her cheeks. Well, she is going to go right back to work.
Yeah, that's fantastic.
Because they're watching her right now on TV, and they say, "Get back here."
That's incredible. And again, it took no time at all. Where else? We talked about her cheeks, and of course you can call us 644-9840.
Yeah, please.
Where else is Radiesse and Juvederm
She doesn't.
appropriate
I don't
for?
think she needs it, but we do. Filler certainly in the valleys here. We could connect the marionette lines around the corners of the mouth if they're turned down, and she doesn't have a problem with that. And one of the things that we do on older individuals, as they start to develop the jowl, now keep in mind, we're not really fixing the problem, we're sort of camouflaging it. But if individuals have a fullness in the jowl area, there's a hollow just in front of that. If we fill that hollow in front of the jowl starts to disappear. And that's nice because we're not fixing the problem, because the problem is more loose skin where the jowl comes down. But by filling that area, it's beautiful. It can really make a nice improvement.
And may I say, this is why you go to a qualified plastic surgeon for this. It's very horrifying when I hear that there's parties that they give out in LA. And they have just anybody injecting anybody.
Well, you know,
not a good thing.
Well, you know, the advantages of a board-certified plastic surgeon doing this is I know the anatomy. So when I put that needle in, I've seen those bones, I've seen those muscles, I know exactly where they're going to end up. It's different than someone that may not be a plastic surgeon, board-certified plastic surgeon, that hasn't, you know, done the facial injuries when they were in training. They haven't done the face lifts and the facial rejuvenations. They haven't done those surgical procedures, because that makes a big difference. Something as simple as when I do Botox, I know that the muscles around the eyes are so thin. If I stick that needle in too far when I do my Botox, I'm not going to have much of an effect, or I might get the wrong effect. The muscles in here are a little thicker, so we can go into the belly of the muscle. The forehead is very thin. You know, I've seen these muscles up close and personal, and that makes a difference. So I think there certainly are a lot of qualified doctors that do that, but I think they need to consider that when they're considering where to go to. It's not like buying a refrigerator.
No, and we do have a phone call for you. Good morning. Hi.
Good morning.
Go ahead, please.
I lost a lot of weight, and a lot of it was from my face.
Right.
And I want to know, when you smile, that line, she doesn't have it, but that line that goes from your nose to like your lower jaw.
Yeah.
Right.
That's really deep, and it's actually more pronounced on one side than the other. Is that something that the injection would help, and how much would that cost?
Yeah, we certainly can do injections there. And what I just want to use Kim to point out, although you said she doesn't have it, and I agree with that, but as we get older, the gravity makes these deeper. So we could do surgery to lift them up, or we could temporize the aging process by putting some volume in here, filling up that valley, so that valley doesn't show as much. And the advantage of that is that it's a non-surgical procedure. It takes no more than a few minutes, like we just showed on the air today, and then she leaves with softening of those lines. Now, if you've lost a lot of weight or you've got a lot of aging changes, then it's probable that we'll have to do something with a surgical
But that's where the free consultation comes in.
Exactly. Yeah, you get the free consultation because you called us today.
Oh, Doc, thank you so much. Kim, awesome.
Thank you.
You're beautiful.
Thank
beautiful.
you.
And
Thank
what
you
we
for the
wanna
hand.
do- anytime. Let's leave you again with the information, because you know, everybody, you want to look your best, and you can. The Aesthetic Associate Center, Plastic Surgery and Advanced Skin Care. Dr. Sam Shatkin is there. Call 1-800-GR8-LOOK. Call for an appointment at 839-1700. Visit them at 2500 Kensington Avenue, and also now at 268 Main Street in East Aurora, and online, gr8look.com. Kim, Zach, you're fantastic.
Thank you.
You're welcome. Doc, good job.
Thank you.
All right, everybody, we'll take a quick break and be right back.